This PowerPoint serves as an overview or guide as to how we as faculty and you as a beginning dentist can approach evaluating your restorations or tooth wax-ups as you prepare for your practicals. The first tip is to observe the overall balance. You'll notice on the picture on the left, if you can pry your attention from the picture on the right, that the left patient, even though she has pretty broad central incisors, they still blend with the adjacent teeth and her overall smile. However, on the right, they don't blend at all, and the tooth is not even the same shape as her other central incisor. For tip number 2, we'll look at the video. You'll notice that all of the contours of the teeth should line up and match the adjacent teeth, as well as the cusp tips and incisal edges. This shows the mandibular arch, but it will be the same for the maxillary arch as well. You'll also want to make sure you're looking at it from every perspective, buccal, lingual, occlusal, and even mesial and distal, to make sure that the curves and the edges all line up. Now we're going to focus on the embrasures and the interproximal contact areas for the maxillary arch, but these principles will also apply to the mandibular arch. You want to make sure that the mesial and distal halves of each embrasure are symmetrical. The interproximal contacts should be closed and not let light pass through them. You also want to make sure your interproximal contact areas are not too broad, because if they're too broad, they can strangle the papilla and lead to poor periodontal health. Make sure that you observe those interproximal contact areas from all 3 directions. So by the 3 directions, I mean buccal, lingual, and occlusal, so that you can ensure that your interproximal contact is even and that your embrasures are symmetrical. For our last tip, we're going to observe the occlusal surface relationships. And by that, I mean looking at the occlusal table for the developmental grooves, as well as the buccal and lingual cusp tips on the posterior teeth, and the incisal edges and the lingual contouring and surface of the anterior teeth. You'll want to make sure that the central groove lines up and goes from one tooth to the other, especially as you look at the premolar and the molar. And on these posterior teeth, you'll also want to make sure that you have symmetrical contours within the occlusal table itself. Using the tips we've just discussed, we're going to evaluate some restorations done by the student doctors here in the clinics. Starting with the photo on the left, you may notice that the embrasures are mostly symmetrical, but they can be improved because the interproximal contact area is way too broad. You may also note that there is an excess of the amalgam filling here that's overlapping the next tooth. So the marginal ridge should be shaved down to match the same height as the adjacent tooth, and the lack of grooves and anatomy on this filling can also be improved, keeping in mind that the central groove should line up with the central groove of the next tooth as well. Now for the right filling, the interproximal contact is a little bit small. The embrasures are okay on the buccal, but they are not symmetrical at all on the lingual, and that's because of the shape of the filling. So if we smooth that down and fill out the interproximal contact a little more, we could have a better embrasure. In this video, I'm just going to put together all those tips we discussed so that you can evaluate your wax-ups, whether it's 8, 4, 3, or 30. The first thing I do to look at contouring is I may rotate it slowly like this to make sure that there's nothing coming out too far, which we refer to as convex, or under contoured, which we may also call concave. I'll also look at that from this angle here, and I'll follow the edge as I rotate it, follow this area to make sure nothing's coming out over contoured or under contoured so that it wouldn't be visible when I rotate it. You can also do that from this direction, looking at the same area. From the occlusal, you can make sure the central groove is lined up on your posterior teeth and the incisal edges are lined up on your anterior teeth. If I go from the distal, I can make sure the cusp tips are not angled or jutting out too far one way or the other, and that your occlusal table is even and centered. From this view, I'll also want to make sure that the lingual surfaces of the anterior teeth are all blending together. The last thing I'll point out is the embrasures. So from the occlusal, you can see buccal and lingual embrasures. And then from a lingual or from a buccal view, you'll notice the occlusal or gingival embrasure, or in the front, an incisal or gingival embrasure. You won't see it on the stone cast, but on your Typodont, you will have interproximal contact areas where light will show through in the embrasures gingivally and occlusally or incisally. So you want to make sure your interproximal contact is a point where light does not come through, because if light does come through, you have an open contact and that's a food trap. The last thing is this angle where I can tell how long the teeth are. So you want to make sure your wax up is not too short or too long compared to the other teeth. As you go to the posterior teeth, they do curve upwards. However, each cusp tip is still blending in with the adjacent one. So you want to make sure no cusp tips are hanging down too far or too short gingivally. Make sure you get a lot of critiques, look at it from every angle, keeping these in mind, and practice a lot so you can do well for your practical. Thanks for your attention, and I hope this video was helpful.